Grab your heaviest Theraband, coming to lie supine, with the ball under the sacrum. Bring your pointer fingers to the bony protrusions of your hips, guiding them down for lumbar extension. Take your dominant leg up in the air, wrapping the band around the arch of the foot, dorsiflexing it, trying to guide the tailbone down at the same time, squeezing the front of the quadriceps, stretching out the central hamstring and the gastrocnemius, and also working on dorsiflexion in the foot to combat that plantar flexion. Holding it here. Inhale, brace the abs. Exhale, allow the tailbone to drop a little bit more, finding deeper lumbar extension. Watch out for the ribs. When we arch our back, it's very easy with the overactivity in the pecs and the shoulders to round the shoulders and push the rib cage forward. So make sure you're allowing the shoulder blades to imprint into the floor as the sternum reaches towards the shoulder blades. Keep that going. That deep stretch for these posturally tight muscles. We're on our dominant side, so we want to give it a full minute. Feel free to pause the video if you need more than a minute. Postural stretches should be held for a minimum of a minute. It could be a maximum of 3 to 5 minutes. Go ahead and switch sides, setting up for our footwork, dorsiflexion of the feet. This nice stretch for the gastrocnemius and the hamstrings. Heavy the heel of the foot that's down for stability purposes. Watch out for the rib cage. Keep guiding the chest towards the shoulder blades and imprinting the shoulder blades and back ribs. Keep the shoulders plugged down the back. Retract your chin. And make sure you're breathing here. Inhaling laterally like an opera singer, breathing into the side body, pulling the abs in, lifting up on those muscles that stop your stream of pee as you fog a mirror with your exhale. From here, we'll set the band to the side, lifting the hips up, sliding the ball out. We'll make our way up to stand on the roller with the 3-pound weight and the ball between the knees. Make sure you have a wall or bar or counter to hold on to for safety purposes. Soft bend in the knees. Hinge forward from your hips. And we're going to do some back flies here with a slow 6 count up. Brace the abs. Exhale, lift. 2, 3, 4, 5, 6. Inhale, lower. 2, 3, 4, 5, 6. Brace, exhale, lift. 2, 3, 4, 5, 6. Inhale, lower. 2, 3, 4, 5, 6. 2 more. Lift. 2, 3, 4, 5, 6. And lower. 2, 3, 4, 5, 6. Last one. Tailbone back. Abs in. Lift up on those muscles that stop your stream of pee. And lower. 2, 3, 4, 5, 6. Grabbing the ball. Bending the knees to slowly step off, switching sides, setting up. Once you have hinged forward, the ball's between the knees, the inner thighs are engaged, the shoulders are plugged down the back, the chin's retracted, the sternum's reaching towards the shoulder blades, the tailbones sticking back, finding that lumbar extension. You'll take the arm out. 2, 3, 4, 5, 6. You'll inhale, lower. 2, 3, 4, 5, 6. Hinging forward from the hips. Soft bend in the knees, tailbone back, inner thighs engaged. Lifting up. 2, 3, 4, 5, 6. Inhale, lower. 2, 3, 4, 5, 6. Brace the abs. Exhale, lift. 2, 3, 4, 5, 6. Inhale, lower. 2, 3, 4, 5, 6. And lift. 2, 3, 4, 5, 6. Inhale, lower. 2, 3, 4, 5, 6. Keep those abs pulling in. Exhale to lift. 2, 3, 4, 5, 6. Inhale, lower. 2, 3, 4, 5, 6. Soft bend in the knees. Grab the ball. Step off slowly. From here, we'll set the band. We'll set the weight to the side as well as the ball and the roller. We'll grab our lightest loop band to bring around our ankles, standing by a wall, making sure you have room to travel in the frontal plane. We're going to take the hands behind the head, stepping to balance and knee flexion. Inhale, exhale, pulse the thigh of the leg that is lifted up. 2, 3, 4. Inhale, pulse lift. 2, 3, 4. Inhale, pulse lift. 2, 3, 4. Go ahead and step back to the position you started in. Stepping to the side, making sure you're stepping onto a parallel leg, foot, and there's a soft bend in the supporting knee, dorsiflexion in the foot of the lifted leg. Hands are behind the head, chin is retracted. On your exhales, you're pulsing the thigh up. After 3 inhales and exhales, we're going to switch to the other side. Breathing, bracing the abs, pulsing up. 2, 3, 4. Inhale, pulse lift. 2, 3, 4. Inhale, pulse the thigh. 2, 3, 4. Step back to the starting position, stepping last time on the second side to balance. Inhale, prepare, brace the abs, exhale, pulse. 2, 3, 4. Inhale, prepare, brace the abs, exhale, pulse. 2, 3, 4. Last one, inhale. Pull the abs in, lift up on the muscles that stop the stream of pee, and brace. Keep your chin retracted, sternum reaching towards the shoulder blades. Slowly take that band off, coming to the wall for an eagle serratus anterior release. The serratus anterior is your shoulder blade anchor. Eagle up your arms, crossing one elbow under the other, grabbing your wrist, making sure the tailbone's imprinting against the wall. The feet are walked forward in a penguin position, heels together, toes fist distance apart. You're going to allow your upper body to round forward, keeping the tailbone connected to the wall. You'll move your elbows away from the chest. As you exhale, you'll inhale them back towards the chest. Exhale them away. Inhale them towards. Exhale away. Inhale towards. And exhale away. Release the bind and round up. Switch the bind so the opposite arm is underneath, grabbing the wrist, folding forward, moving the elbows away from the chest. Exhale. Inhale them back towards the chest. Exhale, move the elbows away. And inhale back towards. Last time, exhale away. And inhale towards, releasing the arms to round up. Turn and face the wall with your legs hip distance apart. Soft bend in the knees. Step your dominant leg back. Look over your shoulder. Make sure the leg is parallel and the foot is parallel. You're going to pull your abs in. You can look back at the wall now. Bracing the abs. Drive the pelvis forward as you drive that back heel down. Stretching out your central calf muscle, outer calf muscle, the gastrocnemius. Very overactive postural muscle. We'll be here for a full minute. Use this chance to not only stretch your calf out, but to check in with your checkpoints and contract that TVA to alleviate your lumbar pain. Make sure that the tailbone is pointing back, creating lumbar extension, and you're not tucking your pelvis under. You're pulling your abs in and up like you're putting on a tight pair of pants. You're lifting up on those muscles that stop your stream of pee. You hear your exhales as if you're fogging a mirror, or as if you're being punched in the gut and you're bracing. That contracts that deepest layer of the core, which is what we really need to condition to alleviate low back pain. Go ahead and step that leg in. Feet start hip distance apart with micro bend in the knees. Step the opposite leg back. Look over the shoulder. Make sure the leg from the top of the hip is parallel. That'll mean the foot will be parallel. You're going to have a deeper bend in the front leg. You should only have maybe a little micro bend in the back knee, back leg's knee. Pelvis is square to the wall in front of you. Abs are pulled in and up. Collarbone is wide. Sternum is reaching towards the shoulder blade. Shoulders are plugged down the back. Each exhale is a chance to go deeper, pressing the pelvis towards the wall and driving the back heel down. Inhale, prepare, pull the abs in, lift up on those muscles that stop your stream of pee and fog a mirror. One more, inhale, abs in, lift up on those muscles, hold the lift, and going deeper into that stretch. Go ahead and step forward. Great job.